Hello and welcome to Case Management 203, the VI-SPDAT and Coordinated Entry. I'm your trainer, HMIS System Lead Tricia Cano. During this session, we will be showing you how to enter the VI-SPDAT assessment into HMIS through a Coordinated Entry project. Please note we will only demonstrate how to input the data for the VI-SPDAT into ServicePoint correctly. This training is not about how to actually complete the VI-SPDAT assessment on your client. If you have any questions, please feel free to contact us at the HMIS Help Desk at our email, hmissupport@cir.org, or by phone or text at 602-908-3605. Once you log into the system, if required for your workflow, get into Enter Data As mode to the correct coordinated assessment project. In this case, for the example today, my user account is at the Coordinated Entry project Welcome Center. So I don't need to use the Enter Data As mode. Next, you should backdate to when the VI-SPDAT interview was actually conducted, if necessary. So for this example, I'm going to say the interview was done on April 5th, 2015. Set back date. And I'm going to use that date because it's actually HMIS policy that all data must be entered within 5 business days. Next, you're going to go to your Client Point module on the left and click on it and search for your client in HMIS. You can search for them by name or by HMIS ID number. For training today, I have my test client all ready to go, so I'm just going to click on their name and open their record. Go to the Entry Exit tab on the client record, and you're going to create an entry into the Coordinated Entry project, in this case, Welcome Center. So click the Add Entry Exit button. Ensure the provider is correct. The type will be HUD, and ensure the date is correct. Click Save and Continue. Once you click Save and Continue, the Maricopa UDE assessment will automatically default open. This opens first because HUD requires us to try and collect all of the universal data elements of anyone who is entered into HMIS. I will go over this assessment briefly because it should have been covered in your HMIS 101 class, so I'm not going to spend a whole lot of time on it. You must enter your client's date of birth, their primary race, secondary race if they report one, ethnicity, gender, if other gender specified, do they have a disabling condition, what was their residence prior to project entry, that means last night, if others specify. How long did they stay in the place of prior residence? Let's say 1 to 3 months. Zip code of last permanent address. This is not necessarily this prior residence. This is the last place they were housed for at least 90 days. I'm going to say they were living in Mesa last. If you're not sure of the zip code or the client isn't sure, remember you can hover your cursor on the question and it'll give you a cheat sheet. Relationship to head of household is self. Location is always AZ502. That is our continuum of care code. Homelessness primary reason.
Length of time on street in an emergency shelter or safe haven. These set of questions, along with other questions in the assessment, will help you determine if your client is chronically homeless. Please answer these questions on all heads of households and adults. Let's go over to the first question. Client entering from the streets, ES or SH. To the right, answer from the pick list, yes or no. Answer yes if the client is entering your project directly from a place not meant for habitation, an emergency shelter, or safe haven. Answer no if the client entering your project from any other location. Diversion and homeless prevention projects should choose no. So for this scenario, I'm going to choose yes. And to the next question, if yes, for clients entering from streets, ES or SH, approximate date. If your client is coming from the streets, ES or SH, you should have the client look back to the last time the client was not on the street, ES or SH. I'm going to give you a few guidelines, you can call them rules, to answer some of these questions. If there was a break in their time on street, ES or SH, of less than 7 nights, do not count it as a break. It would be one continuous episode of homelessness. If the client experienced a break for more than 7 nights, count a break in between episodes. If a break in time was 90 days or less due to an institutional stay, such as jail, substance abuse or mental health treatment facility, hospital, or any other similar facility, that time should be included in the start date time. If the client was at an institutional stay for longer than 90 days, they're considered to be housed. If the client knows the month that the homelessness started, but not the exact day, use the day they're entering from your project with the month and year that they reported, because this is self-reported information. Documents in HMIS may be used only to jog the memory of the client, but cannot be substituted for information they provided directly to you. If the answer above was no, then just leave this question blank. So for this scenario, I'm going to say 10/9 of 2014. Next question. Regardless of where they stayed last night, number of times the client has been homeless on street in ES or SH in the past 3 years, including today. So please record appropriate answer for number of times the homelessness experience in the past 3 years for any combination of place not meant for habitation, emergency shelter, or safe haven. When counting episodes, please use the guidelines and the rules that I explained previously. Never in the past 3 years should be used for diversion or homeless prevention projects only. So from this pick list, you would choose never in 3 years, 1 time, 2 times, 3 times, 4 or more times. So for this scenario, I'm going to say 2 times. Total number of months homeless in streets in ES or SH in the past 3 years. So from this pick list, you would count the accumulated number of months the client was homeless and residing in one or any combination of these 3 locations in the past 3 years. Please note, any single day or part of a month spent homeless should be counted as 1 full month. So if it's more than 12 months, you don't have to calculate anything more than that. You would just put in more than 12 months. So I'm going to choose more than 12 months for this scenario. Then we have length of time homelessness, status documented. To answer this question, yes or no, indicate if there is documentation of the client's length of homelessness, either in the client's paper file or in HMIS for either the number of times homeless or number of months homeless in the past 3 years. So this is asking for proof. So you can answer it either yes or no. I'm going to answer it yes for this scenario.
Once you have the universal data elements complete, click the Save button at the bottom right-hand corner. Do not click Save and Exit because you are not done yet. Just click Save. Scroll up to the top and look for the Select an Assessment section. Before we go on to the VI-SPDAT, I just want to point out this Universal Entry Assessment option here. This is an optional assessment that you can complete if you happen to gather additional information on the client, such as income, non-cash benefits, health insurance, or disabilities. Also, if this client has been seen by other agencies, you may be able to view previous information entered on the record by viewing this assessment as well. All right, let's go on to the VI-SPDAT. So click on the VI-SPDAT pre-screen assessment to make it active, and let's complete it. First, you should put in the interview date. Because I'm in backdate mode to the day that the interview was completed, I can just use the shortcut of clicking on this calendar with the green check mark, and it will fill in the date of April 5th. Type in the interviewer name. This is the person that actually conducted the interview. If you are just the data entry person and someone else conducted the interview, their name should be listed here. Don't worry, if we ever needed to know who the data entry person was, we can see that in the history. And then what agency does the interviewer work for? Choose the agency from this list. If the agency you work for is not on this list, please contact the HMIS help desk so we can correct it. Next, we have the actual VI-SPDAT sub-assessment. So you would click the Add button, and you would complete all of the VI-SPDAT questions based on the interview that you did with the client earlier. So I'm going to quickly go through and answer these questions. There will be totally hypothetical because, as I stated earlier, we do not train how to complete the assessment, just how to put it in HMIS. So total length of time on street, how many times in the last 3 years, emergency room, police interaction, taken to the hospital, crisis services, hospitalization for mental health, have you ever been beaten up, have you ever threatened to harm yourself or someone else, any legal stuff going on, people force or trick you to do things, engage in risky behavior, and what kind of place do you usually sleep? Does anyone think you owe them money? Any income coming in on a regular basis? Do you have enough money to meet all your monthly expenses? Do you have activities that bring you happiness on a daily basis? Do you have people in your life for convenience? Do people ever take or borrow your things? And then as the surveyor, you ask, observation only, don't ask it, any signs of poor hygiene or daily living skills, yes or no? If you're doing a phone interview and you cannot observe the client, then you have to say no. Where do you go when you're not feeling well? And then you have the medical conditions. And this is now or have you ever had. So I'm just going to go through really quick and throw some answers in here. Like I said, this is a completely hypothetical situation. And then the surveyor observation question. Any problematic drug use, consumed every day for the last month, injection drugs, ever been treated but returned, and ever blacked out due to alcohol use. Again, surveyor's observation. And then taken to the hospital against your will for mental health reasons. Sought psychiatric professional, ever had a serious brain injury or head trauma, ever been told you have a developmental disability, and problems concentrating. Again, there's surveyor observations. Do you have medicine that's been prescribed but that hasn't been filled, and any history of abuse. Once you've completed all of the questions based on the answers your client gave you, then you can click the Calculate button, and it will add up all of their points and give you their score, and then tell you what the recommended intervention should be. So my pretend client today scored a 12, which is a intervention of permanent supportive housing. Click Save when you are done, and it will return you to the VI-SPDAT pre-screen assessment, and now you will see that your VI-SPDAT interview questions scores have been filled in, and you can see the total as well. Next, answer the next 3 questions. Was the client actually seeking shelter or housing when they showed up at the coordinated entry today? Yes or no? And then if you were not able to complete the VI-SPDAT right here, the sub-assessment, why not? Some of the options are cognitive functioning. The current assessment wasn't expired, so that means when you opened up the client's VI-SPDAT pre-screen, there was already a VI-SPDAT done with the score. And if the date is less than 6 months old, you don't need to conduct another one. And so then you would say current assessment is not expired. If it was more than 6 months old, then you can go ahead and do a new assessment. Did the client disappear on you? Did the client end up being diverted from homeless services? Was the client actually housed, intoxicated, a language barrier, or the client refused to participate in the assessment? If they did do it, then you just leave it blank. And finally, you have the question of what's the client's contact information, so if a case manager in the future needs to try and find them or get a hold of them. So click the Add button on the Client Contact VI-SPDAT information window. Don't worry about the dates, but put in, if the client happens to have, say, a cell phone number, put their number in here. Oops. If they have a secondary phone number, or say a relative phone number where if you contacted this relative or this friend, they could find the client for you, you can put this here. Where is the client usually found? Where do they live? What area of town do they usually live on? Let's say 14th Avenue and Adams. And I'm just making it cross straight up here. Any additional notes you feel like you should put in about this client that you assessed? Anything that a future case manager might need to know? We gave you lots of room. And then finally, your information as the case manager or a future navigator. What's your contact information? And I'll put our phone number. And then once you complete this, click Save. Now at the bottom right, click Save and Exit to save all the information that you've gathered, and you will be returned back to your Entry Exit tab. So you have completed the process of entering the client into a coordinated entry project, filling out their universal data elements, filling out their VI-SPDAT pre-screen assessment. Now the last step is exiting them from the coordinated assessment project. Normally at this point, based on the client's VI-SPDAT score, you would try and refer them to the appropriate provider for assistance. The coordinated assessment system in Maricopa County is not using referrals or the eligibility functions in HMIS at this time, so you can just go ahead and exit your client from HMIS. You do this by clicking on the Edit Exit pencil icon, and it will open up your Edit Exit Data screen. Ensure the date is correct. It's fine that it's the same day that they entered. Choose your reason for leaving. This is usually completed program, but there are some exceptions, such as if the client disappears during the assessment or they are unable to complete it due to illness. A client can also refuse to finish the assessment. There is an option as well for clients who ended up being diverted from homeless services. Your supervisor can help you choose if you're not sure of the right answer. And then their destination. Unless you know that the client is being immediately referred and housed, say, in emergency shelter, the destination you should choose should be the same answer they gave for their residence prior to project entry. So I put my client came from a place not meant for habitation, and so that will be their destination, back to the place they came from. Like I said, unless you know for a fact they are immediately being accepted into another shelter. Then click Save and Continue. And you have the assessment disposition question. Please complete this based on the client's VI-SPDAT score. So in this case, the client, my pretend client, had a score of 12, which means they really should be referred to permanent supportive housing. If for some reason your client didn't finish the assessment, then choose another appropriate choice, such as applicant terminated the assessment prior to completion. Then click Save and Exit at the bottom. This completes the training, and you can go back to your home screen or log out if you're done with your work for the day. Now let's go over a summary of key points we covered. Number 1, if you are entering a VI-SPDAT interview that was done on a previous date, you should use the backdate mode in ServicePoint. Number 2, you must complete the Maricopa UDE assessment to the best of your ability before you fill out the VI-SPDAT pre-screen. Number 3, you must fill out all the additional questions on the VI-SPDAT pre-screen assessment, such as interviewer date, name and agency, as well as whether the client is actually seeking shelter, and if the VI-SPDAT wasn't done, then why not, and client contact information. Number 4, you can view or complete additional information on the client, such as income, non-cash benefits, health insurance, or disabilities by clicking on the Universal Entry Assessment. And 5, you must exit the client from the Coordinated Entry project and complete the assessment disposition question. By following these steps and working through the system, you have completed training on Case Management 203, VI-SPDAT, and the Coordinated Entry. As a reminder, if you have any questions, please feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.